I didn't go to my doctor complaining of any of the symptoms that are known, pounding heart, shortness of breath, this kind of thing. I think I went just for more or less a regular checkup, and he brings out his cold stethoscope. They've always got cold stethoscopes. And he said, there's something there, a little beat or something. I better look into this. So, okay, fine. All right, you're the doctor. So what did I do? I had an EKG, I think, and blood pressure and what have you, and results came back, and he said, well, yes, you do have a skip beat, which we call atrial fibrillation. Okay, so what do you do about it? What causes it? I did experience shortness of breath coming upstairs, but I thought, well, I'm out of shape. That's all it is, you know, but apparently this can be a symptom of A-fib.
I woke up one morning and I didn't feel well. I was extremely tired and just something wasn't right. I came downstairs and sat in a chair, and the longer I sat there, I knew my heart was racing. And the longer I sat there, the more worried I got. Then when my fingers started tingling, and I thought, oh my goodness, maybe I'm having a stroke or a heart attack. So the ambulance picked me up and whisked me off to the hospital, but my fibrillation had actually stopped when I hit the fresh air at the door. But of course I continued with the ride to the hospital and let them check me over, and it was at that time then that they diagnosed that I was having atrial fibrillation.
It's really interesting that the symptoms that patients will experience really differ from patient to patient. So I've had some people come into clinic who are in atrial fibrillation, so the top half of their heart isn't beating correctly, and they don't even notice a difference. You know, they'll be able to carry on normal routine life, and nothing's stopping them at all. And on the other hand, I've had some patients who will say that the symptoms of atrial fibrillation are so distressing to them that they actually have to take a day off and not even come in and see me in clinic. I've had some people leave messages saying, Jeff, I'm really sorry I missed clinic. I had an A-fib spell, and I just don't feel like leaving the house.
I was feeling like I had two hearts. I had the bottom heart and I had the top heart. And the top heart would try to beat the bottom heart. It's almost like a hockey analogy. One was, you know, the Vancouver Canucks, the other was the Toronto Maple Leafs, and one of them was going to win, but it was always going to be the Vancouver Canucks. The Toronto Maple Leafs would never win. So when I went back and forth, you start hearing your heart. You start realizing that something's going on inside, and then it stops.
Some patients describe it to me as my heart is flopping around in my chest like a fish flopping around, or I feel an irregular pounding in my chest, but it's a sensation in the chest of a rapid irregular heartbeat, palpitations if you like. Common other symptoms include shortness of breath, dizziness, weakness, lightheadedness, occasionally chest pain.
I feel it very early in the night. I have this kind of thought that something is going wrong, and when I start hearing my heart early, I know that it's something that's a little bit abnormal. So I monitor it a little bit more. And that's when I kind of have this, you know, this image of, I need to go to the hospital because something's going on. And it may be, you know, I just need to go for a walk. And I'm kind of tricking myself into thinking, okay, I'm just going to a walk. That's it. And I'll end up at the hospital. Or I'll walk past it and then just be like, okay, I don't need to go, and then I'll just walk back. But every single time that I decide to, you know, actually take that walk, I second guess myself the entire way. Do I need to go home? Do I need to go to the ER?
It's interesting to me as a researcher, and we have proved this, that the amount of atrial fibrillation is not necessarily related to how much the patient suffers. So for example, some patients have a lot of atrial fibrillation, and that's kind of worrisome, but it's not dangerous, it doesn't bother them too much. They may have atrial fibrillation every day, but they get along and it bugs them a little bit, but they have a normal quality of life. Other patients have atrial fibrillation infrequently, maybe once every few months, but they find that they feel terrible, and then they're afraid of recurrences, and they restrict their activities. They don't want to go out, and they don't want to visit friends or travel or be out of town. And so therefore their quality of life is impaired or troubled by the fact that they have the condition, even though they don't have a lot of it. Which means that for the doctor, you can't just simply count the number of attacks of atrial fibrillation and say, oh, the patient has a lot of it, I must do this. You have to have a conversation with the patient. This is important for patients to realize as well. You need to have a conversation with the doctor and make sure the doctor understands how much is this condition bothering you.